Integrative health. There are three types of health approaches according to our textbook. So the first one we're going to talk about is conventional health approaches, then complementary health approaches or CHA, and then integrative health approaches or IH. Sometimes you'll see this referred to in your text as integrative healthcare. Conventional health approaches is also known as allopathic or Western medicine. It involves treatment of symptoms and disease using drugs, radiation, and surgery. So this is what we as Americans are used to. This is our everyday health system. However, CHA or complementary health approaches refers to interventions that are not typically part of conventional medicine but can be used together. Okay, so these are alternative medication or alternative medicine rather, alternative approaches. Current integrative health or IH refers to the combination of both complementary health approaches or CHA as well as conventional health approaches. And they coordinate together. And there's an example in your book where it talks about treatment of cold symptoms. There's a small table and it shows you complementary health approaches, and then it talks about integrative health approaches. And all right, I don't have your page number for you. For nurses to know about CHA. So many patients use CHA in their own personal lives as an outpatient. Sometimes they do not disclose this information to the healthcare provider, so the nurse must ask about any over-the-counter drugs, supplements, herbs that are being used in addition to those medications described, because patients often don't see them as medications because they're more natural remedies. So many patients use them outpatient, and when they come inpatient to a hospital, they want to continue to use them, right? So then we have nurses are then expected to administer and prepare these medications or supplements, and therefore we should be aware of them. Also, many nurses are specializing in holistic care and expanding their practice to incorporate complementary health uh, um, approaches. So many nurses are getting certified. So we have the American Holistic Nursing Association where you can become board certified as a holistic nurse, and they are performing holistic treatments within their treatment practice as a nurse. Many institutions provide complementary therapy to inpatients. I know when I worked at Mainline had nurses that were certified as holistic nurses, and they actually came in and did Reiki, which is an energy healing therapy where you do not actually touch the patient. However, there's just transference of energy. So many healthcare institutions are starting to recognize complementary healthcare approaches and are integrating that into this care of their patients, providing integrative healthcare. So here are some terms you need to know. So allopathic medication, we talked about briefly. So it's conventional medication, Western medication, they're all interchangeable, those words. The treatment of symptoms, disease, use of drugs, radiation, surgery, and illness can be either mental or physical. Okay, that's allopathic medicine. Then holism. Holism is the theory and philosophy that focuses on connection and interaction between parts of the whole. So these parts consist of physical, mental, emotional, sexual, cultural, social, spiritual, energetic dimensions of the person. Okay, so all these different parts of the person works together as one whole. That's the theory and philosophy of holism. So holistic nursing. Holistic nursing is the practice of holistic therapy. It also includes self-care, not just caring for your patient, but making sure that you are whole as an individual. And healing the whole person is the goal. So we are not only concerned with the physical element that has brought them to the doctor, but we're concerned with the entire person being healed and being whole. Integrative healthcare is a combination of both allopathic and complementary and alternative modalities in order to heal the person. Health. So the World Health Organization defines health as the complete physical, mental, social well-being, and not merely the absence of disease or illness. Allopathic conventional Western medicine. So the belief is that health is the absence of disease. And this is conventional medicine, right? The main cause of illness are pathogens, and the process of curing is seeking to destroy the invading organism or repair the affected part. Emphasis is on disease, and high technology such as drugs, surgery, radiation are key to restoring health. Reasons that people may choose complementary health approaches, and that's because they want to have control over their own health. They may have a holistic philosophy of health. They may be seeking to improve their health or relieve themselves of symptoms or avoid side effects of conventional medicine. Categories of complementary health approaches, according to our text, include mind and body practices, natural products, and other mind and body approaches. So, mind and body practices involve movement, or they're movement based. So, the mind ability to affect the body's function and symptoms is considered mind and body practices. An example of this is yoga. So, then we have natural products. So, nutritional and herb remedies include the use of herbs, vitamins, minerals, and diet. And other body approaches. So, other body approaches include anything that does not fit in the above categories, such as traditional healers, such as shaman, or a medicine man or medicine woman. So I do want to say special attention to yoga, and we'll talk about yoga a little bit later. Energy healing therapies. So energy healing therapies include therapeutic touch, or TT, healing touch, or HT, or sound healing. So TT, or therapeutic touch, is the process of energy exchange by the use of their hands on or near the body with the intent to help or heal. So I did mention Reiki earlier on. And so in this practice, my understanding is they are not touching the patient physically. However, they're just gently gliding their hands over the patient's body as they lie still. Then we have HT, or healing touch, which uses a gentle touch to assist in balancing an individual's physical, emotional, spiritual, and mental status. The goal is to enhance the patient's ability to self heal by restoring wholeness. Then we have sound therapy, or I'm sorry, sound healing. Sound healing is used to promote relaxation, healing, sleep, and decrease anxiety. Scientific premises of therapeutic touch. A human being is an open energy system. Anatomically, a human being is bilaterally symmetrical. Illness is an imbalance in an individual's energy field. Human beings have a natural ability to transform and transcend their conditions of living. Shamanism. Shamanism is the most widely practiced medical system. Illness is thought to originate in the spirit world, and the shaman or medicine man or woman accesses the spirit world to obtain information on the proper treatment. The treatment may consist of retrieving lost soul energy, restoring the individual to the right relationship with the spirit world, and treating symptoms. Healing techniques involve native plants and herbs, animals, rituals, ceremonies, and purification techniques. Homeopathy is the belief that like cures like, the notion that a disease can be cured by a substance that produces a similar symptom in a healthy person. So, homeopathy is an alternative healing approach that uses highly diluted natural substances to stimulate the body's own healing mechanisms. The law of minimum dose. The notion that the lower the dose of the medication, the greater its effectiveness. Many homeopathic remedies are so diluted that no molecules of the original substance remains. Principles of naturopathy. Naturopathy focuses on the body's capacity to heal itself, prevent health problems, and a person's personal responsibility to optimize health. Naturopathy practitioners use different treatment approaches, including dietary and lifestyle changes, stress reduction, herbs, and other dietary supplements, manipulating therapies, and practitioner guided detoxification. Yoga is a mind body practice, and many people use it to help with chronic illnesses and such as musculoskeletal pain and their neck joints. This is on page 891. Supplements are not regulated by FDA and cannot be marketed as preventative, treatment, cure, or diagnosing of a disease. This is on page 880, 90, I'm sorry. And ginkgo biloba is a natural supplement used to decrease mental confusion and memory loss. Biloba dilates blood vessels, and a nurse must know the side effects of these natural remedies as they may impact the patient's health and their current medication regimen. This is on page 899. And the shaman accesses the spirit world and returns with the proper treatment. This is on page 904. Question number one. Allopathic medical care has been totally effective in dealing with chronic illnesses. True or false? So we did do some test taking strategies the other day. And so anything that says something that's absolute always is likely not true, right? So it says totally effective in dealing with. Totally, I don't know about totally. So I would probably say false. Answer is false. Allopathic medical care has not been totally effective in dealing with chronic illnesses. Question two, healing touch can be used to stimulate wound healing. True or false? So a few slides back, we talked about scientific research in reference to therapeutic touch and the promotion of healing. And the answer for question two is true. Healing touch can be used to stimulate wound healing.